Okay, we have a little over half now that have joined, so maybe it's 12:03. We'll just sort of start talking about some of our housekeeping. My name is Cheryl. I work for the Northumberland Family Health Team. I am the program assistant. We're going to talk about COPD today. Still don't have all of you in. I'm looking for a couple more people. So we've just flipped up our screen now. I don't think our person has joined us yet who needs this, but if any of you would like to see closed captioning, which means you'll see little subtitles on the bottom of your screen about what is being said, then by all means, you can go to the bottom of your Zoom screen, the way it's shown here. You click on that closed captioning button and it'll say show subtitles. You click on that and you will start to see the subtitles scroll up on the bottom of the screen. For anybody who wants to do that, you can go ahead and do that now. All right, and if you want to just progress so your housekeeping points come up. So we just like to let everyone know today a couple of things. The webinar is going to be approximately 30 minutes. Our presenter will be Anna Tolonen. She's going to introduce herself in a minute. If you have any questions, if you look at the bottom of your screen, whether you're on your phone or on a tablet or on a computer, you'll see a little chat button. If you want to click that, you can at any time put in a question. We're going to save our questions probably to the end of the session, but we will keep an eye on it and we'll answer anything in chat that we can. Our other nurse, Colleen Lewis, is going to help us with that. So we also ask that you keep in mind as you ask questions and participate in the webinar of normal meeting etiquette of please be polite, please listen to others respectfully, and also please be aware that we are recording this session so that those who couldn't join us today can see the information later, and we'll also be sharing our PowerPoint. So don't worry about trying to write too many notes really fast. We're gonna make all this available to you, and you can always email us and ask us for more. We'll share that information at the end. So I think I'm just taking a look again at our participant list. I think we've probably got most of our people in now. So I'm going to turn this over and let Anna introduce herself.
Hi, everyone. My name is Anna Tolonen. I'm a registered nurse with the Northumberland Family Health Team. Along with Colleen, we run a program called the Home-Based Transition Care Team, which works with people living with COPD and congestive heart failure who are discharged home from hospital, and we provide education and support usually for about that 4 to 6 week window after they're discharged home. So I'll turn it over to Colleen and she can introduce herself.
Hi guys, my name is Colleen Lewis. I am a nurse practitioner that works with the Family Health Team, and I work with Anna with the Home-Based Transition Care Team. That's one of the hats that I do. And yeah, we're happy to bring this presentation to you. I'll be monitoring some of the chat box, so if you have any questions, we can address them when we get to the end. But with no further ado, I will let Anna take it off.
Okay, so upon completion of this webinar, you'll have learned about the following topics. So we're going to cover what is COPD, including causes, symptoms, diagnosis, treatment, medications, and triggers. We're going to talk about what exactly is a COPD flare-up, including how to prevent and treat it. We're going to cover breathing techniques and positioning to help with shortness of breath, as well as energy conservation techniques. Coping with anxiety is going to be a topic we're going to briefly cover, as well as COPD and exercise. And the final topic we'll cover is chronic disease and advanced care planning. So the first topic we're going to cover here is what exactly is COPD. So COPD is also known as chronic obstructive pulmonary disease, and it consists of two breathing conditions. including chronic bronchitis and emphysema. So these partly block and cause swelling in the airways of the lungs. These conditions can occur separately, but oftentimes they do occur together. So emphysema affects the alveoli, or tiny air sacs at the tips of your lungs. So normally these air sacs expand like balloons as you inhale and exhale, but emphysema stiffens the alveoli, making it difficult for them to stretch. So as a result, air gets trapped inside, causing symptoms like shortness of breath and fatigue, or the feeling of being tired. And chronic bronchitis causes swelling, irritation, and inflammation of the airways. So there are glands in your airways which produce more mucus, which prevents some air from passing through. And this can cause you to cough up mucus, and feel short of breath. And you can see here in the pictures on the left, you have an example of emphysema and where the tiny air sacs are in the lungs, the alveoli. And on the right, you have chronic bronchitis, and you can see the difference between a normal healthy airway, which is nice and open, and the one on the right is the inflamed and narrow airway. So what are the actual causes of COPD? So the number one cause is smoking, but there are other causes as well. So secondhand smoke is a big one, as well as air pollution, which includes dust or chemicals, repeated childhood lung infections, severe asthma or asthma combined with smoking, as well as there's a rare genetic disorder called alpha-1 antitrypsin deficiency, which makes people more prone to developing COPD. So what exactly are the main symptoms of COPD? So some of the main symptoms include feeling short of breath, and this can be actually more with physical activity, more than what you would normally feel with increased physical activity. The feeling of feeling tired or being fatigued, cough that lasts a longer period of time. So this is 3 months. Cough with mucus production, wheezing, which is tight, kind of narrowed airways, and more frequent infections such as colds, flus, and pneumonia, and just taking longer for your body to recover from these. So some people do think that developing shortness of breath is a normal part of aging, but this is actually not true. So if you do have any of these symptoms, it's important to speak with your primary care provider. Now we'll just cover how exactly COPD is diagnosed. So to properly diagnose someone with COPD, it does require a few steps. One of the first things that may occur is an assessment by your primary care provider, in which several questions could be asked. So some of these questions can include, have you smoked in the past? Do you currently smoke? How often do you experience shortness of breath? Are there things that make your shortness of breath worse, and what are they? Do you cough? How often and when did this start? Do you cough up mucus? Do you have a family history of lung disease? Did you have a lot of lung infections when you were younger? So from there, your primary care provider may order certain tests like spirometry. So spirometry is a simple test which assesses your lung function by measuring how much air you can breathe in and out of your lungs. It also measures how easily and fast you can breathe air out of your lungs. Spirometry is technically the gold standard test for diagnosing COPD. So along with the spirometry, you may have other tests ordered. Another test is something called a chest x-ray, which again, it can't diagnose COPD alone, but can help support the diagnosis of COPD. Chest x-rays can show signs of damage that are caused by COPD in your lungs, like emphysema or just other signs of damage caused by COPD. Another test which may be ordered, but not always, is called oximetry. So this test involves using a probe which sits on your finger, and it measures the amount of oxygen in your blood. Again, it's not used alone to diagnose COPD, but it can be used to help reach a diagnosis. Other tests that may be ordered include a CAT scan, blood work, things like that. So that's kind of the main way that COPD is diagnosed. Now, when COPD is diagnosed, we're going to cover like how is it treated. So COPD is a chronic progressive illness, which means there is no cure and it will worsen over time. But with early diagnosis, lifestyle changes, and drug treatments, they can help optimize your quality of life and reduce hospital visits. So quitting smoking is one of the most important things you can do for your health. It prevents additional lung damage and will decrease the possibility of getting chest infections, cough, mucus buildup. So it really is never too late to quit smoking and can provide, you know, a good boost to your quality of life. There are many smoking cessation programs available to help support you through this process. If you're a part of the family health team here in Northumberland, we do have a smoking cessation program available, which involves counseling as well as free nicotine replacement products for, I believe it's 6 weeks. I could be wrong. If you're not a part of the family health team, there's a program called Stop on the Net, which is run by the Center for Addiction and Mental Health. And this provides 8 weeks of free smoking cessation medication, which is mailed within 2 weeks of registration. And there's an option to join an online program to help you quit or reduce vaping or smoking. Enrollment is limited to 1 per person and 4 per household within a 12-month period. So to find out more and see if you qualify for this program, you can check out the link we're going to provide at the end of the presentation, the resource page at the end of the presentation. So
Anna,
yes.
Oh, sorry, Gerald has just had his hand up for a little while, and I just didn't know if there was anything, if maybe there was a question, Gerald.
Hi, Gerald, I've unmuted your mic. You can speak.
It looks like he is still muted.
Is he? Oh, here. We'll ask to unmute.
I think you've muted him again.
Sorry, Gerald, try that again. We've just asked you to unmute.
Can you hear me?
Yes, we can.
Okay.
Hi.
Anna, you're speaking too fast.
I'm sorry. I'm trying to speak as slow as I can.
Well, I'm trying to read it and I can't. It's going too fast. It goes. Okay.
Okay.
I have COPD and I quit smoking almost 50 years ago.
Oh, good for you.
I'm
Okay.
very interested in your program.
Okay. I will try to slow down as much as I can. I apologize.
And
Thank you.
we'll make sure we get this presentation to you and to everyone else who maybe is trying to read along or is trying to absorb all this information. So we'll also make sure that we send you along our notes and our PDF, okay? Great.
Yes.
All right.
Okay. So just to move on then. So again, how is COPD treated? So taking your medication as directed can help improve your COPD related symptoms you experience and your overall quality of life. So taking medications regularly and exactly as prescribed by your healthcare provider is very important, as missing or skipping doses may impact your well-being. So it's important to know the name of each medication, what they are for, time of day to take your medication, how to take your medication properly, and any side effects or precautions you should be aware of. So if you have any concerns or questions about your medication, don't hesitate to ask your primary care provider, pharmacist, or nurse. Keeping up to date with your vaccination can also help protect you from contracting illnesses that you may be more prone to getting with COPD and help prevent you from getting a COPD flare up. So as well, these vaccinations can help reduce serious illness caused by diseases like COVID, flu, that kind of thing. Sorry, I'm losing my train of thought here. So the main vaccines that we're kind of looking at right now, of course, is COVID vaccine. So eligibility is changing very frequently. To keep up to date with COVID vaccine information, you can check out our website, www.nfht.ca/COVID vaccine. Another important vaccine for those with COPD is the flu vaccine. So it's offered on a yearly basis, and it's important to get that each year. In Ontario, there's a few pneumonia vaccines which are available. There's something called Pneumovax 23, which is free for adults 65 years and older. There's another one called Prevnar 13, which can be purchased on an individual basis for seniors 65 years and older. Another way COPD is treated is oxygen therapy. So not everyone with COPD requires oxygen, but some will if the damage caused by COPD causes low levels of oxygen in your blood. Home oxygen is not a cure for COPD, but it can help improve quality of life and help you live longer. It's important to remember that oxygen is like any other medication and should be used as prescribed by your healthcare provider. So now we'll move on to COPD medication. So there are a variety of oral and inhaled medications that can improve your COPD symptoms and quality of life. These include inhalers, such as bronchodilators and combined bronchodilators and anti-inflammatories. Other medications include antibiotics, supplemental oxygen, and as discussed, vaccines. So in terms of inhalers, the main type of medication, inhalers are the main type of medication for COPD. It reduces the risk of COPD flare-ups by taking them on a consistent basis. As mentioned, there are inhalers called bronchodilators, which open up the airways and make breathing easier. So these can be the short-acting variety, which is such as Ventolin, which some of you may know as the rescue inhaler, as well as Atrovent. There's also long-acting bronchodilators, which need to be taken every day or twice a day, every day. And these include such names as Incruse and Spiriva. There's also combination long-acting bronchodilators and or corticosteroids. So these contain 2 to 3 medications in one inhaler, and again, need to be taken every day, either once a day or twice a day usually. Some of the main names include Advair, Breo, Symbicort, Anoro, Duaclear, Inspiolto, Ultibro, and Trelegy. but there's many more that aren't listed there. So inhaler technique is essential to manage and prevent symptoms like shortness of breath and wheezing caused by COPD. Using certain inhalation devices and maintaining good technique can be challenging for some, but learning the right technique, while it may be difficult, is important for the medication to get to your airways and work properly. There are many, many different types of inhalers, so too many to cover in this webinar. But if you do have any concern with your inhaler technique, speaking with your doctor, nurse practitioner, nurse, or pharmacist can be really helpful to ensure you have the proper inhaler technique for the one that you do use. Another type of medication used to treat COPD are oral medications, which are tablets or pills. And these are include corticosteroid pills, which are usually used for a short period of time. And that's usually during what's called a COPD flare-up. We'll cover what a COPD flare-up is in a little bit. So they are usually used on a short-term basis, but some people do require them for a long period of time if they are having frequent COPD flare-ups. One of the main type of corticosteroid pills is called prednisone. Another main type of medication used to treat COPD is antibiotics. So you may see these prescribed for bacterial infections in the lungs, which can lead to a COPD flare-up. So these won't be helpful if your COPD flare-up is caused by a viral source. But as mentioned, if it's a bacterial source, antibiotics can help kind of kill the bugs that are causing that inflammation in your lungs. So antibiotics are usually prescribed on a short-term basis as well, but some people with COPD have to be on them on a regular basis as well. So just to remember, it's really important to take your medications regularly and exactly as prescribed to get the full benefit out of the medication to help improve your COPD symptoms and quality of life. Now we'll just move on to something called COPD triggers. So COPD triggers are things that can worsen your COPD. So common triggers include things like scent, cold air, or hot, humid air quality, wind, smoke, chemicals, emotions, and respiratory infections. So as you learn what things worsen your COPD, you can try to do things to avoid them. So in terms of, take for instance, indoor air quality. Some things you can do to ensure good indoor air quality are things like keeping your home smoke-free, airing out your living space with fresh air, keeping your living space clean and uncluttered, and trying not to use really harsh smelling or strong cleaning products inside your home. Now, in terms of outdoor air quality, poor air quality outside can happen at any time of year, and you really don't have much control over what's happening outside. So poor air quality can be caused by things like vehicle exhaust, forest fires, things like that. So things you can do to watch for the air quality outside include, checking the internet, your local news to see what the air quality is like, and choosing to stay inside in an air conditioned environment if it's a poor air quality day. So now we'll move on to what exactly is a COPD flare-up. A COPD flare-up occurs when your COPD symptoms get worse, and they are usually caused by COPD triggers. So this is the main reason people with COPD go to the hospital for treatment, and they really should not be ignored. So how do we handle a COPD flare-up? Things you can do include trying to stay as healthy as you can, recognizing the flare-up symptoms, and starting to treat the COPD flare-up quickly if you're experiencing symptoms. And knowing when to call your doctor or go to the ER is also very important. So in terms of staying healthy, we can try to avoid catching the flu, colds, and other infectious diseases. And you can do that by getting vaccinated for things that you can get vaccinated for, ensuring you get proper amount of sleep, nutrition, and exercise are all good ways to try to stay healthy. Staying away from sick people. So if you know your family member, your friend is having some symptoms, it's really best to just, stay away from them until they start to feel better. Maintaining good hand hygiene, such as using alcohol washing your hands as frequently as you can, especially if you're out and about in the community, can help you stay healthy as well. And following your COPD action plan. And we're going to cover that in a minute. But if you don't have one, asking your doctor about getting one, perhaps, or having that discussion to see if it's appropriate for you. All right, so now we're going to talk about recognizing COPD flare-up symptoms. So the main symptoms of a COPD flare-up include feeling more tired than usual, having increased shortness of breath beyond your usual, more coughing than usual, or perhaps you're coughing up mucus and it's kind of like a funky color, like green, yellow, brown, or rust. With COPD, it can be normal to cough up mucus, but knowing what is your normal versus what is not is important. You may also just cough up more mucus than usual, or it may be thicker or stickier. Other symptoms you can have include fever, sore throat, or general cold symptoms. You may need to sit up or sit in a chair to sleep, or you just generally feel under the weather and unwell. So COPD flare-up, this is an example of a COPD flare-up action plan. And it's really important to start treatment early if you're having symptoms. So flare-ups can happen suddenly, and it's important to understand and follow your action plan right away. So your action plan may consist of medication like antibiotics and or corticosteroid pills, and instructions provided by your doctor on how and when to use them. So if it is directed for you to use the action plan early, like I said, you should follow that direction, as treating your flare-up early can actually decrease your chances of getting severe illness and prevent further damage to your lungs caused by flare-up. If you don't have an action plan, you would want to call your family doctor if you're experiencing any of these flare-up symptoms. And this is just an example of what a COPD flare-up plan may look like. You have the green section, which normally would have what is normal for you in terms of mucus or sputum, and then what you would do with your puffers on a daily basis. The orange section is when you're starting to feel unwell with COPD flare-up symptoms, and then what you would do about that in terms of treatment. And the red section is what you would do if you're feeling, you know, very unwell. You would want to go to the hospital or call 911. And that's actually this section here, just to cover when to call 911. Obviously, you would want to, you know, a lot of people can tell how they're feeling, so you kind of go with your gut. But it really, if you're having, you know, chest pain, trouble breathing that doesn't get better with rest, or just that's abnormal for you, your lips or fingers are turning blue, or you feel drowsy, confused, agitated, that kind of thing. Those are all, you know, indicators you would want to be seen at a hospital. Just waiting for the closed captioning here. So now just to move on to some of the main symptoms of COPD, which is shortness of breath, or the feeling of being breathless. Breathlessness can occur when you exercise or engage in activity, but some people feel breathless most of the time. Breathlessness can cause feelings of anxiety, but there are things you can do to make it easier. So some people like using a fan in front of their face to help relieve the feeling of being short of breath. And there's also breathing techniques and positioning to reduce breathlessness as well, which we'll cover here. So the first breathing technique we'll talk about is called pursed lip breathing. I'll just show you this quick video. It works.
There you go, Anna. Try that. Anna, can you try turning up the volume?
Sorry, one sec. Is that better?
Pursed lip breathing is one of the easiest ways to help control
A little bit, but I think it's going to be too quiet for us today.
making each breath more effective. With your mouth closed, breathe in slowly through your nose. Then breathe out slowly through your mouth with your lips in a whistling or kicking position.
Oh, we got feedback. Sorry about that, folks. We will include that video link in our email out so that you can see it later.
Okay. So just to describe what pursed lip breathing is, you can see there's a little bit of a picture here. It's very simple. So you start by keeping your mouth closed and breathe in slowly through your nose. From there, you purse your mouth like you're blowing out candles or you're whistling. And keeping your lips pursed, you breathe out slowly, making sure the breathing out phase is longer than you did to breathe in. So you can see here in the picture, the gentleman is breathing in on 1 and 2, and then breathing out for 4 counts. And that can just help slow down your breathing and in turn help reduce the feeling of shortness of breath. So another breathing technique which can be helpful for shortness of breath is called diaphragmatic breathing or belly breathing. So diaphragmatic breathing starts, you sit comfortably in a chair with relaxed shoulders. You can place your hands on your stomach and breathe in slowly through your nose, allowing your stomach to rise under your hands. From there, you breathe out slowly through pursed lips, and you feel your stomach fall back to its normal position. Waiting after each exhalation until you're ready to take another deep breath is an effective technique when you're doing belly breathing. And there's just a little diagram here as well. So be quite effective for people. One of the ways you can do this is by sitting. So as shown in the picture here, you can sit comfortably in a chair and place both feet on the ground and shoulders forward slightly. And with your arms relaxed, you rest your hands or rest your arms or elbows on your knees. And you can do the pursed lip breathing at that point as well. Another way you can position yourself to reduce breathlessness is by standing. So to do this, you can lean against a wall, a chair, or apart, and lean your head and shoulders forward slightly while staying relaxed. Hands on your thighs or a piece of furniture. Now we'll move on to energy conservation. COPD can cause you to be quick. So doing things that conserve energy may help you feel you're maybe from something you absolutely want to get relaxed and trying not to be like making sure it's within your limits. So again,
sorry, everyone. It sounds like Anna has lost her internet connection a little bit. She's it's dropped her off the presentation. We apologize for that. While we're waiting for Anna to connect, we do have Colleen on the line. Is there anyone that wants to ask a question at this time? And Colleen maybe can help answer those questions.
Sure, I'm having a little bit of some computer issues too. My camera just decided not to work, but I am here. So if anyone has any questions, feel free to, you could even just raise your hands at this time while we wait for Anna to come back.
Well, it looks like she's kind of back here, but if you look at the bottom of your screen, there is a raised hand by all means. How you doing, Anna? Are we back?
I think so.
Yeah,
Can
you're pretty choppy. I don't think your internet's cooperating too well. Oh, there's a Q&A. What is the difference between COPD and emphysema? Colleen, can you answer that?
Sure. So emphysema is one of the subheadings of COPD. So emphysema, COPD, they are very much the same. If you could go back to the very first slide when we get to it, or if you want to go back when you look at this, you'll be able to see that emphysema is a form of COPD, right? Emphysema and then chronic bronchitis is the other branch of COPD. So COPD is the main title, and then the two main diagnoses from COPD is emphysema or the chronic bronchitis. So that there really isn't a difference. They're very much one and the same, but the two under that COPD umbrella do look a bit different.
All right. Any other questions somebody has? If you want to raise a hand, put it in the Q&A, put it in the chat box. We can unmute
Can you hear me better now?
Yeah, that's much better, Anna.
Okay.
Do you want to try flipping the presentation back? Oh, hang on. No, I still have you on as co-host if you want to try flipping that back up.
Can you see it now?
Not yet. Well, there you go.
Okay.
Yeah, you're back up.
Okay?
Go ahead, Anna.
Okay, perfect. Any questions, or should I just move on?
I think we've caught a couple of the question that we had, if you want to carry on.
Okay. I'm not sure where you lost me, but I'll just continue. So planning your schedule ahead, making sure it's within your limits is a good way to conserve your energy. And also pacing yourself. So physically pacing yourself as you walk, not rushing around, trying to kind of hurry everywhere, but taking your time and really trying to focus on your breathing, making sure you're not overwhelming yourself by moving too fast can help conserve energy. So as discussed, positioning your body and environment can help with decreasing breathlessness. So we talked about the sitting and standing postures. Things you can do as well to help with positioning are things like limiting the number of times you climb stairs. So perhaps grouping what you would want to do upstairs for a certain amount of time, and then grouping the activities you want to do downstairs to help limit the number of times you go up and down stairs can be helpful. Or sitting while preparing a meal, chopping vegetables, or like if you want to perhaps fold laundry, so sitting while you do that can also be helpful. As mentioned, the breathing techniques are also helpful. The pursed breathing when you're exerting yourself, when you're walking upstairs, a hill, that kind of thing. And just trying to maintain a positive attitude can really go a long way with conserving energy as well. Cheryl, is the closed captioning working?
Yeah, it is.
Okay, just wanted to make sure. So now
Although-
we'll move on to, sorry.
I was just going to say, although maybe not quite as well as we hoped, sometimes it doesn't translate words perfectly.
Yeah.
Just so everyone knows, it is automated. That isn't us typing. So we just have to live within what the AI can do. But yeah, go ahead, Anna.
Okay. So now we'll move on to talk about COPD and anxiety, something called the anxiety breathlessness cycle. So shortness of breath caused by COPD can lead to anxiety and panic attacks for some people. In turn, anxiety can cause shortness of breath to worsen, leading to even more anxiety. And as a result, reduced activity and fatigue can occur. So having reduced levels of activity can affect your breathing, causing shortness of breath again to worsen further. And as you can see, that's just this vicious cycle that keeps repeating itself. You experience shortness of breath leading to anxiety. You don't really want to move around as much because you're afraid of feeling that way. And so you don't. And then over time, having that reduced activity can make your lung function even worse. There are ways to cope with anxiety. I think I'm missing a slide here. Oh no, I'm not, sorry, my bad. There are ways to cope with anxiety. So the first thing we'll talk about is just a little visualization exercise, which can help with just reducing your levels of anxiety. So the first thing to do is to start, imagine a positive image in your mind. I just put a picture of a beach up here, but it could be anything that you find, you know, relaxing and positive. And you just bring that image into your mind and try to just relax as you visualize the image. And you can use your senses to make the image as real as possible. So, you know, perhaps you're hearing the sound of waves crashing on a beach. You're smelling the smell of the ocean, things like that. Really trying to bring that image into your mind to make it as real as possible. And as an end to that, you would keep that in your mind for a while. Just try to keep that in your mind for as long as you can. And then you can do this on a daily basis, and that can help, as mentioned, reduce anxiety. Of course, there's the breathing exercises we discussed, the pursed lip breathing and belly breathing, which can be helpful as well. And then, as mentioned, stressful emotions can cause you to feel short of breath. And while that may be uncomfortable, there are other ways to cope with anxiety. So trying to plan ahead and avoid situations that may cause stress can be helpful for some people. But if you're unable to avoid these situations, making plans to reduce the stress as much as possible if you are having to experience them can be effective as well. Now, if you do become anxious and short of breath, finding a comfortable place to sit and beginning the breathing exercises like the pursed lip breathing can help bring your anxiety levels down. Another way to do this is by speaking with your support system about situations that cause stress. So if you let them know what causes you anxiety or what will set off your breathing to cause more anxiety, they'll perhaps be able to kind of help you through that process as well. And then of course, there's mental health counseling that's available to help with feelings of anxiety or depression. We do have some counselors available at the family health team if you are part of the family health team, but there are some free resources in the community as well, which we'll cover at the end of the presentation. There'll be a resource list for you to have a look at. So we'll just shift gears a little bit here now and talk about COPD and exercise. So exercise is one of the most important things you can do to help manage your COPD. While it may seem easier to take it easy and rest, this in the long term can actually worsen your breathing. Exercise can help improve your energy level and help you breathe better, basically. So what are the benefits of exercise? So when you're less physically active, your muscles, including your heart, become less efficient. Your muscles work harder, causing you to feel more breathless and tired. But exercising regularly can strengthen your muscles and help your heart and lungs work more efficiently or better. And as a result, you'll be able to do more with the same amount of effort. Exercise can also help maintain a healthy weight, help your body fight off infections, and improve your energy level and your mood. So exercise does not have to be complicated. You can start slow and pace your activity. And as you get stronger, you can do a bit more or exercise a bit longer. So one of the best ways to exercise, if you're able to do so, is by walking. It's simple, it's free, and it can help improve your overall fitness. It's important to speak with your family doctor or your nurse practitioner before starting an exercise program, just to make sure that it is appropriate for you. And you can also discuss when to take your inhalers, coordinating that with your exercise program. And there's something called pulmonary rehab as well, which may be appropriate for you. It's more of a organized exercise and education approach to treating COPD through those through exercise. And that's something you could talk to your family doctor about to see if it is something that would be appropriate for you. And now we'll talk about what exactly chronic disease means when it comes to COPD. So COPD is known as a chronic disease. This means that COPD is a long-term condition that will worsen over time. It's not curable, but there are ways you can slow the progression of this disease. This also means there can be periods of wellness and of illness with severe symptoms. And it's kind of like a curvy line, like a wave up and down. So advanced care planning is something that everyone should do. It's a time for you to think about what's important for you if you were sick or injured and you couldn't speak for yourself. So when it comes to advanced care planning, having a substitute decision maker is very important to have chosen. This person can speak for you if you're unable to speak for yourself. And it's very, important to let him or her know your wishes and the type of care you want and do not want. So why is this so important? It can be difficult for others to make decisions for you if they don't know what your wishes or your values are. So, having these conversations as soon as possible can be very helpful, especially when you're healthy and able to have these conversations and convey your wishes. So of course you can talk about your wishes at any point. After a flare-up of your chronic condition can be the perfect time. You can write down your wishes or make an audio or video recording. Some people like to do that. And of course, this can change at any time. And it's not just a one-time conversation. These can be conversations that you have frequently and, repeatedly over time as things may change or your values or wishes may change over time. So to find out more, you can talk to, you know, your family doctor, your nurse practitioner. We do have some community partners that specialize in talking about advanced care planning. The link will be available at the end of the presentation as well. And then there's a good resource online at www.advancedcareplanning.ca. So that concludes the body of our presentation. Thank you very much for listening. If you have any questions and you're just listening to the recording of this webinar, you can email them to info@nfht.ca. And for those of you who are listening presently, you can write any questions in the chat box below at the bottom of the Zoom screen.
You can also raise your hand. So you'll see at the bottom of the screen, there's a little raise hand button, or there's a Q&A, which seems to also be working now. So either or. Oh, there we go. There's something in the chat. Thanks. Great session. Thanks for doing this for us. You're welcome. We appreciate the feedback. By all means, we will continue to send out information to everybody.
Now, Anna, I was wondering, while you were coming back, Walter had a question of the difference between emphysema and COPD and how that fits. And you had a great slide. Is there any way that you could go back to that slide and it might open up a little bit, just clarify a little bit how emphysema and COPD fall together?
Just finding it here. So yeah, you can see these are just kind of a visualization of it. With emphysema really focuses on the little air sacs at the tips of your lungs, as you can see here on the left-sided picture. So the air sacs are where the oxygen comes in and the carbon dioxide kind of goes out. So they stiffen up and they don't expand and contract as well as a normal healthy alveoli. So when that happens, the alveoli kind of stay stuck open, and that can cause shortness of breath, lower oxygen levels, things like that. And with the other part of COPD, COPD is like an umbrella term which covers emphysema and chronic bronchitis. And you can have either one or the other, or you can have both together. And then, so chronic bronchitis being the other element of COPD is when there's a lot of inflammation and irritation inside your airways, which blocks, kind of narrows your airways with mucus and things like that, and makes it harder for you to get the right amount of air in and out of your lungs, which can cause you to feel short of breath. So yeah, these pictures kind of show it here, the way the difference in the airways, how they have a nice open airway here on the left, and then a more narrowed airway on the right.
So yeah, that pretty much says it, right? COPD is sort of, the blanket, and then usually you're diagnosed with one or the other, or very rarely both, sometimes both, which is a little bit further. I hope that answered your question, Walter, a little bit. Did anybody else have any questions? Robert, it looks as though you have your hand up. I'll just click that you're able to talk. I think you need to unmute, Robert. Okay, go for it. I think we can hear you.
Okay, great. I love playing pickleball, but shortly after starting to play, I feel a little breathless, but I work through that as much as I can. Is it recommended or suggested that I stop when I do that, or just keep playing? How far can I push myself?
Well, have you considered, I guess it also, maybe it's a conversation you could have about your puffers. Maybe, you know, if you're taking your puffers regularly, I mean, having that kind of exercise is great. I'm not totally familiar with pickleball, but I mean, like we said, exercise is amazing. If you're feeling really short of breath, that it's compromising you, then I would definitely maybe look at how physically exerting yourself you are going. But maybe you can work in some of your puffers to help you have that exercise experience. Anna, is there anything else that you could include?
Yeah, I would say, I mean, having a certain amount of shortness of breath with activity is okay. You just don't want it to get to the extreme where you're very uncomfortable and you're feeling ill, that kind of thing. So yeah, and of course using, if you are on puffers, perhaps using, you know, like a Ventolin before you exercise may help. That can help open up your airways before you, you know, engage in the activity, things like that. Yeah. You can always check with your family doctor as well, just to make sure, you know, they're aware of you doing this kind of activity, that kind of thing.
Okay, thank you.
You're welcome.
Anyone else have any other questions? So I think that's pretty good. So I suppose we can wrap it up. You can always refer back, the slides will be up and the resources, and you can always contact the family health team if you have any other questions, or of course you can always contact your family doctor if you have any questions that way as well. Well, thank you so much everyone for joining us, and thank you so much, Anna.
Thank you. Yes, thanks for everyone attending. Like I mentioned, the resources are listed at the end of the presentation. So if you do want to access those, the presentation will be available on it's our YouTube channel, right, Cheryl, or the website?
Yeah, I'll put this video up on the YouTube channel, which is on our website, but I'll also just post up the deck, but I do have a list of everyone attending, and I will send out to everyone just a PDF of the PowerPoint itself, and that way they can click on these resources and see that list too.
Sounds good.
All right, thanks everyone for joining us. I'm gonna just stop our recording and we'll click you off, and have a great day.